In this video, we will be discussing another bacterial disease, that is ulcerative lymphangitis. It is also called as ulcerative cellulitis. Cellulitis is nothing but the inflammation of the deep dermis along with surrounded by the subcutaneous tissue. Uh, the ulcerative lymphangitis, which involves two words, were ulcer and lymphatics. Ulcers is an wound which lost the tendency to heal and which has the uneven borders of the ruptured wound. And the lymphatics is nothing but the lymph vessels which connects to the lymph nodes all along the body. And this disease is also called as the caseous lymphadenitis. Now, let us look at the etiology of the disease. The disease is caused by the Corynebacterium pseudotuberculosis, which is an gram-positive, pleomorphic, and the non-motile, non-spore-forming, non-capsulated rod. And this disease is occurring all over the world, and the more susceptible animal is horse comparatively than cattle and buffalo. That may be because of the overcrowding and poor hygiene measures. When you look at the pathogenesis of the disease, the bacteria will enter the skin surface via skin abrasions, wounds, or by the vectors such as flies and housefly, the biting of these flies, mainly in the lower limb. And after entry of the bacteria, there it multiplies and it again enters the lymphatics. Along the lymphatics, it flows all along the lymph vessels where it causes the inflammation of the lymphatics, lymph nodes, that is lymphangitis, and inflammation of lymph vessels and the skin. Thereby, it produces the nodules throughout the limb, and those nodules will become ulcers. Therefore, this disease has got the name ulcerative lymphangitis. Later on, there the abscess will be formed throughout the lymphatics of the limb. When it comes to the clinical findings, there will be fever because of the exogenous phyrogen, that is, the bacteria will be altering the thermal set point of the hypothalamus, leading to the fever, and formation of nodules will be there. Initially, the nodules located at the fetlock region, and then later on the all around the lymphatics of the lymph vessel. And those nodules are measuring 5 to 6 centimeter in diameter, and they breaks open, leading to release of exudate, which is thick, sometimes mixed with blood, and the pus will be odorless, and leading to the ulcers. The ulcers are nothing but the wound which lost the tendency to heal, and which has the cracked edges, and which contain with the necrotic bases. And apart from that, there will be swelling up lymphatics, and they will become hard and painful, and the swelling up pastern region of the leg will be noticed, that will be leading to the lameness. And in the mild clinical form of the disease, where the ulcers will heal within 1 to 2 weeks, if not treated properly, then the reoccurrence will be seen within up to 1 year. And in chronic form, there will be marked fever will be there, anorexia, weight loss, and all these systemic signs will be noticed, and reoccurring abscess will be there, and that may involve some other internal organs also in chronic form. When it comes to diagnosis, it may be mainly diagnosed based on the clinical signs and the isolation of the organisms from the lesion. The sample to be collected is pus from the external abscess, and sometime we need to aspirate the abscess, then collect the pus and culture it, and then go for microscopy. And to treat this disease, clean the lesions with the mild antiseptic solutions, and dress the lesions, and long-term antimicrobial therapy is followed. Before going to antimicrobial therapy, antibiotic sensitivity test should be performed, and the antibiotics of the choice to be selected, and then the antimicrobial therapy should be followed. And whenever there will be reoccurrence of abscess will be there, the proper drainage and treating will be followed. And to prevention and control, the vectors plays a major role. So control of the vectors such as houseflies, and injuries will lead to accessibility route for the bacteria to enter into the body, so avoid injuries, and mainly the lower limbs are more susceptible, and ultimately the hygiene will play a very important role in prevention and control. So to sum up this disease, it is called as the ulcerative lymphangitis, which caused by the Corynebacterium pseudotuberculosis, mainly noticed in horse, which is characterized by the ulcers and the inflammation of lymph vessels, that is called as lymphangitis and the ulcerative lymphangitis. And sometime ultimately leading to the lameness in the animal. There will be two forms, one mild and the chronic. In chronic form, the lesions will get reoccurring, and therefore it needs intensive management, and diagnosis is based on clinical signs and the isolation of the organisms. The treatment should be the cleaning of the wound with the antiseptic solution and antimicrobial therapy. And this is about the disease. Thank you.